Welcome to this explainer. Okay, today we're tackling a literal medical emergency in the aquarium hobby. We're going to walk through exactly how to urgently and safely treat velvet disease in your fish using precise copper protocols. If you've ever stared at your tank and just felt that absolute pit of panic because something isn't right with your fish, yeah, we've all been there. But don't worry, we're going to break down the science and the exact steps you need to take to save them. Let's dive right in.
So here's our roadmap for this medical rescue. We're covering 5 key steps today: identifying the disease, setting up your hospital tank, dosing copper safely, avoiding some fatal mistakes, and finally, recovery and prevention.
All right, phase 1, identifying velvet disease. Spotting this threat early is absolutely crucial, because with this specific illness, time is definitely not on your side.
You'll often hear aquarists call this fast-moving, lethal parasitic infection by a pretty ominous nickname, gold dust. And it gets that name because of the really distinct visual signature it leaves on the infected fish. But hey, don't let the pretty name fool you. Gold dust is an absolute tank killer. It sweeps through both freshwater and marine aquariums with terrifying speed.
So, what is it exactly? Well, velvet disease is a parasitic infection that literally coats the fish and severely impairs their breathing. But what makes it so stealthy is its underlying mechanism. This parasite has a very specific life cycle, moving through different free-swimming and attack stages. If you miss spotting it early, or even worse, if you mistake its invisible phase for a cure, you're setting yourself up for a devastating relapse where it comes back way stronger than before.
So, what exactly should you be looking for? You really need to watch out for a few distinct physical and behavioral symptoms. The classic visual is, of course, that yellowish-brown or metallic dust on the body and fins. But honestly, the behavioral changes usually show up first. You might notice clamped fins, extreme lethargy, or what we call flashing, which is when your fish starts scratching itself against rocks or glass in the tank. They might also completely stop eating. But the number one, most alarming symptom? Rapid gill movement. If you see your fish gasping, it means they are severely struggling to breathe. The parasite is actively attacking their gills, and you have to act fast.
Which brings us to phase 2, setting up hospital tanks. Once you spot those symptoms, the clock is ticking. We have to move straight to triage and get a hospital tank running right away.
Now, you might be wondering, why not just treat the main display tank? It seems way easier, right? Why go through the massive hassle of catching a fast, super stressed fish and moving it? Why not just dump the medication right into your main display to save time?
Well, here's the absolute deal breaker. Copper is lethal to invertebrates, and copper is the primary medication we use to fight velvet. It is a literal poison that will wipe out your snails, your shrimp, your crabs, and your corals. On top of that, it can completely nuke your biological filtration by killing off all the beneficial microbes in your main system. So treating in the display tank isn't a shortcut at all. It is a guaranteed recipe for a total system crash.
Because of that, you have to set up a strict quarantine environment to safely stabilize your patient. You need a separate, bare-bottom tank. The temperature and salinity must match your main tank exactly so you don't send the fish into shock. You'll also need strong aeration and gentle flow. A sponge filter is perfect here, especially if you can seed it with bacteria from a healthy tank. And this is absolutely crucial. No carbon or chemical media in the filter whatsoever, because they will absorb the copper straight out of the water.
All right, with the patient moved, we are into phase 3, dosing copper safely. This is the make or break moment where we execute the actual dosing regimen. Before you pour anything into that water, we need to talk chemistry. There are 2 very different formulations of copper used in the hobby: chelated copper and ionic copper. Because they are so fundamentally different, your test kit absolutely has to match the specific type of copper you're using. If you use an ionic test kit for a chelated medication, your readings are going to be wildly, dangerously inaccurate. So always validate your test kit's compatibility with your specific brand of copper. So here's the foolproof 4-step method for dosing safely. Step 1, measure your baseline. In a brand new hospital tank, this should be dead zero. Step 2, adjust gradually to your target therapeutic level. Please don't shock your fish by dumping the whole dose in at once. Step 3, maintain it consistently. You've got to be checking your levels every single day. And step 4, treat for the full recommended duration. You have to hold that exact copper level long enough to outlast every single stage of the parasite's life cycle.
Okay, moving on to phase 4. We know the right way to do things, but let's talk about the treatment mistakes you absolutely must avoid.
This right here is the ultimate false cure in fish keeping. Do not remove your fish from copper treatment early just because they look better. It is so tempting. The velvet dust goes away, the fish is swimming around, they seem totally fine, but remember that invisible life cycle we talked about? Those parasites are likely still lurking in the system. Pulling your fish out early practically guarantees a deadly relapse. You have to trust the calendar, not just your eyes.
To keep this rescue operation from derailing, watch out for these specific fatal errors. We already covered avoiding the display tank and matching your test kits, but you also cannot let those copper levels drop or overshoot between tests. Fluctuations are basically either useless or toxic, and like we said, activated carbon is a huge no-no because it actively strips your medication right out of the water. Finally, never mix incompatible medications. Throwing in other treatments alongside copper just skyrockets the toxicity and stress, which could easily finish off a fish that was actually on its way to healing.
Once that strict dosing window is successfully closed and your copper levels are confirmed safe, we transition into our final phase, recovery and prevention.
When you're stabilizing a recovering fish, 0 is the absolute magic number. I'm talking specifically about your baseline tank parameters like ammonia and nitrite. Remember, in a sterile hospital tank, your biological filtration is super fragile. You have to test constantly to ensure those toxic compounds stay at absolute 0. Even the tiniest spike can be instantly fatal to a fish that's already recovering from severe gill damage.
Along with pristine water, you need to provide supportive care to minimize stress and let the fish fully heal. Keep up that strong aeration, those healing gills really need the oxygen. Keep the lights low, and honestly, just reduce your handling and any sudden movements around the tank. Give them some peace and quiet. And when it comes to feeding, don't force it. Just offer small, easy-to-digest portions, but only once you actually see their breathing calm down and their appetite naturally come back.
At the end of the day, the absolute best medical rescue is the one you never have to perform. And that means locking down your prevention game to stop reintroduction. Number 1, quarantine all new arrivals before they ever get near your main tank. Number 2, never transfer water between systems. Literally, a single shared net or a wet cup can transfer the parasite. And number 3, maintain a rock-solid, stable display environment so your fish's natural immune defenses stay strong.
So, as you look at your own aquatic ecosystem right now, I want you to ask yourself, is your quarantine tank actually ready for your next arrival, or are you kind of just crossing your fingers and hoping for the best? Because in this hobby, hope is not a strategy. Real preparation is the only thing standing between a minor inconvenience and a devastating outbreak of gold dust. Thanks for joining me on this explainer, and happy fish keeping!